Hey, welcome back to Not So Complicated, and today we'll be talking about 16 clinical signs you must know as a medical student. Alright, so let's begin from Murphy's sign. So it is usually seen in acute cholecystitis. Alright, so the method of testing this sign is that you have to place hand on right upper quadrant of the patient like this, and then you have to ask the patient to inspire deeply. Alright, so then if the patient stops inspiration midway, or you have to look at the expression of the patient and there will be a bit cat expression. All right, so that is when Murphy's sign is positive. So result is positive. It is due to peritoneal irritation of the gallbladder. All right, so that is Murphy's sign. The second one is Cullen's sign. It is usually seen in hemoperitoneum, especially in the case of acute pancreatitis. The method of testing for this sign is that there will be, like, this is a visual testing, so there will be bluish discoloration around the umbilicus like this, and the cause for this is that retroperitoneal blood will be tracking from falciparum ligament to the umbilicus. All right, so that is why this sign is seen, and the result is positive. Obviously, if the sign is seen due to acute pancreatitis or ectopic pregnancy rupture, this is very common sign in ectopic pregnancy rupture also, so you have to consider that thing also. So the third sign is Gray Turner's sign. It is usually seen in retroperitoneal hemorrhage, and it is also a bluish discoloration on the flank. This is also visual testing like this, and then the cause for that is retroperitoneal blood that will diffuse to subcutaneous tissues. All right, so the result will be positive if the case is seen, and it is seen usually in 24 to 48 hours after onset in necrotizing pancreatitis. All right, so the fourth one is Chvostek sign, and it is seen in hypocalcemia. The method of testing is that you have to tap the facial nerve anterior to ear of the patient like this, exactly like this, and then there will be twitching of the facial muscles. All right, so that twitching of the facial muscles is due to neuronal hyperexcitability due to low calcium. So if that is present, the result is positive, and it is usually seen in hypoparathyroidism or vitamin D deficiency, or also in pancreatitis in severe cases. All right, so the fifth sign is Trousseau sign, and Trousseau sign is obviously seen in latent tetany due to hypocalcemia. These two signs, like Chvostek signs and Trousseau sign, these are for hypocalcemia typically for them. So you have to inflate BP cough or a sphygmomanometer, whatever you can pronounce. So cough 20 mmHg above systolic blood pressure for 3 minutes, and you will be observing carpal spasm like that. And then the mechanism for this is ischemia plus low calcium leads to increased neuromuscular excitability. All right, so that is result positive and seen in hyperparathyroidism, vitamin D deficiency, and pancreatitis. Obviously, the sixth sign is battle sign. It is usually seen in basilar skull fractures. The method of testing for this is you just have to visually look over the mastoid bone, and you will also like see ecchymosis. All right, so like this. So it is associated with CSF rhinorrhea and hemotympanum. CSF rhinorrhea is that instead of like sputum or something like that coming from your nose, there will be CSF coming from the nose. All right, so hemotympanum is there will be blood in the tympanic membrane, and then the mechanism of this is obviously fracture of petrous temporal bone bleeding into the mastoid region. So the result is positive, seen especially in RTA cases, that is road traffic accident cases. So the seventh sign we have is Kehr's sign, that is splenic rupture. The method of testing is palpation on left upper quadrant, just here. So that will lead to left shoulder pain actually. All right, so the mechanism is referred pain due to phrenic nerve. The nerve root is C3 to C5, you have to remember this. So the result will be positive, and it is also seen in RTA cases especially. So the eighth sign we have is Blumberg sign. It is a rebound tenderness. The another name for rebound tenderness is Blumberg sign. So the method of testing is deep palpation in the abdominal region, just like this, and the patient will like show no symptoms in deep palpation, but if you release the pain pressure, there will be pain. All right, so that is what rebound tenderness is or Blumberg sign is. So that is obviously, also known as that. And this is due to sudden stretch of inflamed peritoneum. All right, so it is obviously the result will be positive, seen in peritonitis cases and also sometimes in appendicitis cases. The ninth sign we have is Pemberton signs, and it is substernal goiter. So the method of testing for Pemberton signs is that you have to ask the patient to raise both arms, and what you will see is beyond your comprehension. That is, you will see facial congestion, cyanosis, and venous obstruction like this. You can clearly see the visible difference while raising the arm and not raising the arm in the case of substernal goiter. All right, why that happens is that there will be thoracic inlet obstruction, and that will lead to impaired venous return. All right, so that is why there is congestion and cyanosis and venous obstruction. So the result will be positive in the case of substernal goiter, obviously. So the 10th sign we have is Homan's sign. It is usually present in deep vein thrombosis. The method of testing is you have to passively dorsiflex the feet, all right, and that will lead to calf pain, just like this, visually, just like this. All right, so the mechanism is that there will be stretching of inflamed veins, and the result is positive in deep vein thrombosis. But this is very low specific for DVT. This sign is very low specific for DVT, but it is a classic question. All right, so the 11th sign is Kussmaul sign, and it is seen in constrictive pericarditis, right heart failure. What actually happens is that on inspiration JVP rises, that is jugular venous pressure rises. Actually what happens is on expiration JVP rises in usual cases, but in constrictive pericarditis it rises in inspiration. All right, so this is it for your visual memory. I have just put attached a picture in here. So the mechanism is that there will be non-compliant right ventricle, and that will prevent venous inflow, that will lead to the backup of the blood. That is why JVP rises on inspiration in this case. All right, so there will be non-compliant right ventricle or right heart failure due to constrictive pericarditis, and this will obviously be positive, seen in constrictive pericarditis and RHF. The 12th sign we has is Rupture sign, and this is also seen in acute appendicitis, and the method of testing is quite interesting in this case. So you have to press the left iliac fossa, since we all know that appendicitis is on the right iliac fossa, because obviously the vermiform appendix lies in right iliac fossa. So basically what happens is that you have to press the left iliac fossa, and there will be pain in right iliac fossa. Isn't it interesting? Just like this. And why that happens is that there will be gas distension that transmits straight to the inflamed appendix, and that is why Rupture signs will result in positive due to acute appendicitis. The 13th is McBurney's point, not a sign actually, it is a point. So it is also for appendicitis. The method of testing is press on McBurney's point. That is, what is McBurney's point actually? It is 1/3 from axis, that is like anterior superior iliac spine to umbilicus, just like this. You have to draw an imaginary line between axis to umbilicus, and this point is 1/3 from axis or 2/3 from the umbilicus. All right, so that is where the McBurney's point is, and if you press at that point there will be sharp pain in the case of appendicitis. So it indicates maximal inflammation of appendix base. So result is positivity as seen in appendicitis associated with guarding and also rebound tenderness. So these are the signs you see in appendicitis. The 14th sign we have is Cavousia sign. So it is usually seen in carcinoma of head of the pancreas. So method of testing for this sign is there will be, like, you have to do deep palpation on the abdomen. All right, so the finding is that there will be palpable non-tender gallbladder associated with jaundice. This is very classic sign. All right, so here what happens is there will be a tumor or a mass that will be compressing the bile duct here, and that will lead to the backup of the bile or fluid into the gallbladder, that leads to palpable non-tender gallbladder because the gallbladder is not inflamed yet, but associated with jaundice because there will be no release of bile to the axonal site. All right, so that is why that is what Caviezel signs is positive in the case of carcinoma of head of pancreas. The obviously mechanism is chronic obstruction from malignancy and not from stone. All right, this is you have to remember that is not from stone. So the result is positivity. If the result is positive, suspect pancreatic head carcinoma until proven otherwise. So the 15th sign we have is Kernig sign, and this is for meningitis. So the method of testing is that raise patient's leg. You have to raise the patient's leg after being laid back and to a flexed knee at 90 degrees as shown in the figure right here, and then the leg is supported and straightened. But what happens is that when we support and try to straighten the leg, there will be lower back pain or inability to extend knee. All right, so that is Kernig sign, and it is very positive in the case of meningitis. All right, so the 16th sign we have is Brzezinski's sign, and this is also for meningitis. Kernig sign and Brzezinski's sign, these are classic for meningitis. So the method of testing is that you have to do the passive flexion of neck. This is quite easy, and there will be involuntary flexion of knee and hip. All right, so that is Brzezinski's sign. So the mechanism is that there will be straits of inflamed meninges, right? So the result is positivity. If the result is positive, suspect meningitis. That's all 16 signs that you have to remember, and subscribe for more. And thank you for staying with me until now. Thank you.